It's a little.
Okay. Maybe I just haven't moved enough since I said that. Okay. Here's your copy of her
Okay.
report. Alright, so overall, I mean, it's the same type of, you know, it's written the same way
Yeah.
that David's was. The biggest things that came out, her overall learning is, like her IQ is in the average range. It is.
I think she had like a 99 last time they tested her.
And she's a 91 right now, which is still,
Yeah.
you know, in the same area. So, I mean, we're looking at the lower part of the average range, but still solidly in that average range.
Okay.
Okay. There's no significant difference between like her verbal reasoning skills and her nonverbal reasoning skills. So everything's pretty evenly developed across the board with that. In terms of looking at her academic functioning, most everything was either in the low average or average range. The things that were in the low average range were still not significantly lower than what we would expect based on her IQ for most of the things. So what we're seeing there is that for the most part, she has more difficulty with learning. Like she's got some kind of overall difficulty with learning in general. Just that it's harder for her to learn than maybe some of her same age peers. In terms of a learning disability, I did diagnose a reading disorder. Now, it's specific to reading comprehension, though.
Okay.
In terms of like her reading fluency, like her ability to like sight read or, you know, to give her a paragraph and her read it, that is actually coming up okay. It's more her ability to understand what she's reading.
That's where.
So I did diagnose a learning disability with that.
Okay.
There, in terms of her memory, I looked at her memory there, and because I know she's been having problems like retaining information and stuff like that. What it's showing is that her visual learning, like if we're showing her something, I give her something, she's able to learn that fine. But if she's having to listen and learn it, it's more difficult for her. Okay. When there's a delayed period of time, so let's say a teacher is teaching something and then they take a 30-minute break and then it comes back to it, her memory, like her learning, her knowledge of that information is not decreasing.
No,
it's still there.
See, that's where I see, like, when we were studying, she knows it, but then when I ask her the same thing in 20 minutes, like, she
still knows it. I think what's happening is that she's having significant problems with attention and concentration, and that along with some of the anxiety that she has, are interjecting there. They're basically, it's kind of like a feedback loop.
Okay.
And what's happening is those things are interjecting, and so the information is in her brain, but she can't access it because that inattention or that anxiety is cutting through and sitting kind of right on top of that.
Okay.
So the information's there. That's the good news, is she's not losing the info.
Maybe that's me. Maybe that's why I'm just not remembering. It's just all sitting on top.
And I'll be honest with you, when we're stressed, that happens to all of us a lot more. Like, think about times when you're stressed or there's a lot going on and that kind of thing, and it's harder to focus, and you're like, I was about to say something, I don't even remember what I was going to say. And that starts happening a lot more frequently.
Yeah.
Or you're like, I know I've got something.
I keep forgetting. That's my big thing lately.
And I think a lot of times what happens is we either have stress or we have anxiety or we have different things that are going on, and it interferes with that and basically cuts it off. The information's still there. There's no neurocognitive deficit that we're experiencing. There's nothing, anatomically wrong with our brain. But what's happening is those other things interfere, and so it's cutting it off before we can access the information.
Okay.
So I addressed some specific things in the recommendation section about ways to help with that, ways to help kind of trigger and cue her memory and that kind of thing. Remind me, is she on I'm sorry.
No, they were supposed to.
The
IEP?
Yes.
They were supposed to give her a little bit more time on her state testing, and they did not, and she did not finish 2 of the ones that she did. They're like, oh, we're going to help you, and I'm like, well, she's being tested, and it's going to be 2 weeks, and they're like, oh, well, we'll give her extra time. No, they didn't do anything to like her. So she struggles in social studies and science, and neither one Was she able to finish?
Okay, well, they should be able to let her go back and repeat those tests to finish them with this. Because what I included in this, well, to kind of highlight a couple other points, in terms of the ADHD, I'll be honest with you, there was some stuff that was a little, it was kind of on the border, to be honest with you, about the ADHD. There was enough that I diagnosed it. I did keep the
You're the
diagnosis.
second person that said that.
So it seems like it's a pretty mild form of it, but I mean, it's one of those things that's like, well, I could say, no, she doesn't have it. There's enough going on that suggests to me that I mean, she meets criteria.
Yeah.
So, and I want her to be able to get the help that she needs with stuff. So I don't want to take a chance of saying, well, it's very mild, so no, we're not going to diagnose it, and then she doesn't get the help she needs.
Yeah.
She's also got some significant anxiety and depression going on.
Okay.
So, with that, now how much of that and some of the anger and defiance and some of that kind of stuff, it seems like those things haven't been going on for as long a period of time.
No.
And so because of the brief duration of them, and because they seem to be, for the most part, most of it seems directly related to school or somehow, intertwined with the issues with school, what I diagnosed is depressive disorder, NOS, which is not otherwise specified, and the same thing with anxiety. Because the reality is that it may be, those symptoms are at a significant level. But I'm not going to diagnose her with like major depressive disorder.
Yeah.
The depression, and I think the anger is actually part of the irritability coming from the depression. Same thing with the defiance. She's just getting irritable. She's snapping at stuff.
Well, she finally started her period like the week that, like, I don't know.
That probably has a lot to do with it too. Hormones.
It all came like full circle within like the last couple of months, and then she finally.
Gotcha. So with that, with the depression and anxiety, I don't want to diagnose like a specific disorder because I think it's more related to what's going on in her stress with school and everything that she's been going through, and even just adjusting to the move and her dad not being around all the time, and having some conflicts with that, and I think there's too much going on right now to be like, oh, she's got an anxiety disorder. She had but she does have a clinically significant level of anxiety and depression right now. Mm-hmm. So that's why it's listed as those not otherwise specified things. Okay. In terms of the treatment, I do think that she would benefit a lot from therapy, especially in terms of working on those symptoms of anxiety and depression. Those are the big things because how these things, how her school performance is impacting that.
Okay.
Even in terms of, while she doesn't have any major social problems, there are times when it comes up, that socially she's feeling, she does have problems with feeling inadequate and low self-esteem, and that a lot of that is related to the school, her schoolwork, her performance, things like that, feeling like she's not performing as well as her peers, those types of things. So even just working through some of those issues, not to mention the fact that I know we didn't do any trauma testing or anything like that. I don't know. That's something that is like, it doesn't sound like that's something that's coming up for her a whole lot.
I know when we were going to counseling, when that was going on with her, it was a lot harder for her going. Mm-hmm. And then when we stopped not talking, like when it wasn't put in her face twice a week, she just became like a whole lot better. I mean,
well, and that's what she had said.
Yeah.
That she feels like that that the counseling was not helpful. That once she stopped, she felt like it was a lot better. Like, okay, like stop.
Like if she hears the name Sean, like I can see it in her face. I can tell. You know what I mean? But other than that, and I mean, it's kind of weaned off. It's not so bad, but I mean.
And it's one of those things, honestly, what I listed in terms of the recommendations with that is just that it's important for her to develop a trusting relationship with a therapist or counselor so that she could be comfortable discussing and processing any feelings related to a previous trauma should those arise.
Yeah. Okay.
So that's listed as like a secondary thing of if those come up, not, hey, bring them up.
Yeah.
In terms of behavioral things, with the defiance and stuff at home, basic behavior plans, positive reinforcement, setting goals for, okay, here's what you're expected to do, incentives for you do the things that you need to do. These are the, the rewards you get. you don't do the things you need to do, here's the consequences. You know, you're not going to have access to this. You're not going to have, you know, be able to spend time with friends, whatever it is, those types of things. I listed several guidelines for improving the inattention symptoms and distractibility and things like that. With the educational assistance, I said that it does indicate she's experiencing deficits in reading comprehension, and is strongly recommended the implementation of a 504 IEP be considered to address her learning disability. That should incorporate individualized assistance in classes, extended time for testing, presenting information via multiple formats, so both auditory, like both verbally as well as visually, and assisting her with repeated review of materials to improve retention. Also, given the diagnosis of ADHD, all the specific guidelines for helping with the symptoms of those should be incorporated into her IEP as well. Okay. In terms of psychiatry, I do think that a consult's needed just to evaluate and see if she would benefit from medications with either for ADHD or the mood or anxiety symptoms.
Okay.
It is something that may not be needed, but may could get her kind of at a level where she's at least feeling better, where she's able to start coping with these things better. And then once we can get her more stable with everything, get her off meds kind of thing. And then the other thing is just the group activities, which I recommend for everybody, is just for social stuff and building self-esteem and that type of thing.
Okay.
So I know that was kind of like the rapid overview. The rapid overview of the 19-page report. But any questions that come to the forefront of your mind? I know you're kind of pressed for time today, so I don't want to...
No, I mean, just... Do I take this to the school and be like, do you have a reach? I mean, what do I need to say to them?
You need to call the school and...
I mean, they're really not
whoever
helping me.
whoever you've been talking to already. I would say, and let them know. I have the psychological report, the evaluation report, and two things that need to be addressed. One, I need to know how what we need to do in terms of going ahead and getting the 504 or IEP started, which basically should be this, and they may have one form that her doctor has to just sign off on.
It's kind of, there's 14 days of school left. I mean, and I went to a meeting with all of her teachers a week before she came in here, and they were like, oh, we're going to do this and we're going to do this, and still I haven't got phone calls. I sent emails. Nobody,
Well, what I would do is, even though this stuff is not going to necessarily be implemented this year because there's not enough time, I would specifically say, as I mentioned to you guys before, and it wasn't done in terms of the extended time for testing. So I need to know, what do we need to do in order to have her be able to retake those areas that she did not have enough time to complete.
Okay.
So who do I need to speak with about doing that? And then who do I need to speak with about setting up, getting these plans set up in place so that is she going to be at the same school next year? Okay. So then that way, if they're like, well, we're going to need to wait until the beginning of next year to get that set up so that you'll be sure to meet with all the right people, then that's fine. At least you know that. But the primary thing I would say right now is contact them and say, hey, I have this report.